Hi, I'm Dr. Sumana Shivanand, consultant pediatric pulmonologist, allergist and sleep specialist practicing at Cloudnine Varthur branch, Bangalore. Child would need a sleep study or a polysomnography when there is a clinical evidence of a sleep-related breathing disorder such as mouth breathing on a daily basis, heavy snoring, or in children with genetic syndromes or neurological disorders where you expect a central hypoventilation. So what is done during the sleep study is it is an overnight study conducted at a sleep lab. So there are many connections that are done on the body like EEG connections, some connection that detects the ocular movements, the chest movements, snoring, leg movements, and also a video recording that's done throughout the night. How to prepare your child for a sleep study? If the child is older than 3 years, you can talk to him about how a sleep study is done and how the connections are harmless. Take him to the sleep lab, let him have a look and show them videos of how sleep study is done and explain them how the sleep study is harmless and that they're just sleeping in a different place for overnight.